What's interesting is when our anxiety goes up, our processing goes down. So it's like a seesaw. When someone's asking them a question, they freeze. There's actually something called anticipation anxiety. And really what that anticipation anxiety is the anxiety around what is this going to look like? Do you notice any changes in their behavior? Do you notice more readiness and more encouragement, right? Because I think that there's a lot of strong aspects to this intervention, and I think that it goes really, really far.
Welcome back to another episode of the Unspoken Words podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode of the podcast features Dr. Elisa Shipon-Blum and Dr. Jenna Blum, the director and lead clinical psychologist at the Smart Center's Counseling and Assessments Department, exploring the PVC model, a practical, evidence-based framework built around three core principles: preparing, visuals, and choice questions. Dr. E and Dr. Jenna discuss why simply encouraging a child to be brave or just talk just isn't enough, and how lowering anxiety through deliberate preparation, visual supports, and structured choices can create the conditions for real progress. Dr. E and Dr. Jenna also walk through how anticipation anxiety affects a child before an exposure even begins, and why visuals reduce cognitive load in ways that verbal preparation alone cannot. They also discuss how choice questions can help move a child from responding to initiating. They also cover silent goals and the look, listen, and learn approach, which we talked about extensively on this podcast, that helps with a parent's understanding of what works and what doesn't work for each individual child. If you have any questions on anything you hear in today's episode, head to selectivemutismcenter.org/Ask Dr. E, and make sure you're following the podcast on Instagram and YouTube. We are at @unspokenwords_podcast on Instagram, and Unspoken Words Podcast by Dr. E over on YouTube. All right, without further ado, here is the latest episode of the Unspoken Words Podcast.
Before we get started with the episode, are you a parent of a child with SM desperately looking for resources to share with your child's teachers? Last year's Selective Mutism in the School virtual conference sold out, and we're excited to share that this year we're doing it again. Virtually join me, Dr. Elisa Shipon-Blum, and Jennifer Brittingham on April 10th from 9 a.m. to 5 p.m. Eastern Standard Time for practical, evidence-based strategies you can use immediately in your classroom. Whether you are a school psychologist, educator, speech and language pathologist, or counselor, this conference is designed for you. Plus, all attendees earn 6.5 continuing education credits. Learn more and register today. Visit the link in this episode's show notes. Let's help more students find their voice in school. All right, enjoy the episode.
Hello, listeners. Welcome to another episode of Unspoken Words. Excited to be here with Dr. Jenna. Hello, Dr. Jenna.
Hi, how are you?
Good. How's the weather over there?
It's a little chilly, but it's supposed to get warmer this week.
All right, good. Yeah, I know. We're over those snowstorms, right? Although many of our listeners listening may never have even seen snow, but we feel like we've been buried in it for a while. Anyway, today is a great episode. Often when we're thinking of topics to talk about, it's all about practicality. And there is one specific term I use a lot, as do you and many of our clinicians, that we work with and train on SCAT, the Social Communication Anxiety Treatment Model, which is a CBT-based model. That's called PVC. And the reason I call it PVC, as you know, Dr. Jenna, is we try to come up with terms that people can easily relate to and remember, so that when they're doing the different strategies, when they're planning games, when they're doing goals, they can kind of reach for those kind of known topics that make it easy. And PVC is one of them. You like PVC, right?
Yeah, I use it. I use it all the time.
Yeah. So now our listeners are like, what the heck is PVC? So let's talk about what PVC is. It's an anxiety lowering method, and it incorporates preparing, the use of visuals, and the use of choice questions as a very simple model to use pretty much at any stage of social communication, whether you're at the start of treatment or you're pretty much already verbal, you're beginning to work on initiation, elaboration, expression, whatever stage you're at, you can utilize a PVC model. So one of the things I thought you could talk about was what happens with anxiety, with your ability to think, plan, communicate. I think you'd be amazing to talk about that.
Yeah. So when I think of anxiety and with the PVC model, many times, and I actually was just having a conversation with one of my clients yesterday about this, I always think of like a scale. And I think of anxiety being on like one end of the scale and then processing being on the other one. And so what's interesting is when our anxiety goes up, our processing goes down. It's kind of like this, like, so it's like a seesaw. And what happens is the more that we prepare, we bring visuals, we bring choices, our processing goes up. We don't really need time to think and process, so our anxiety goes down. And then that creates kind of more of that even seesaw rather than like this uneven seesaw. So the whole point of the PVC is that it really does minimize our time to think and process. And that's really important because people with anxiety experience that all the time, where they're constantly thinking of the what ifs, the and or all of these different things. So when someone's asking them a question, they freeze, right? It's like, wait, I knew I wanted to say something. I knew I wanted to say something, but they have to process that. So PVC kind of knocks that out. So when they now are questioned, they can utilize and prepare ahead of time, use visuals, use choices. So now when someone asks them a question, their anxiety is a lot lowered. So they're more likely to have an interaction. So that's kind of how I like to describe it and where PVC really helps with anxiety.
I think what stands out a lot to me is that when we work with clients, families, the many different ones over the years that we've worked with, there's so many people that come to us and say, how do I get my kid to talk? How do I get her to answer her teacher? And there's so many families that come to us that their goal was to go up to a store clerk and ask a question, and they will get, points or money or whatever it is they're working on. But what I often say is, what are you doing to support that? How are how do these individuals with anxiety and whatever their whys may be are exacerbating their anxiety? And I think that's important because the tools that we use and develop are tools to help lower anxiety and support confidence, connection, and overall progress across that social communication bridge. It's not just get a sticker, get a reward to go up and ask a question if they're not able to do it. So what are the supports? And so much of what we do, whether it's the PVC model, teaching the SM triangle, whether it's preparing for common questions, handover, takeover, social engagement opportunities, building social connection, loud, large, lots of people invited. There's so many countless methods and different strategies that we use, action plans, sandwich questions, copy backs. There's millions of them. It's how do we put this together as a recipe for a person? It's not just be brave to go up and ask a question. And those that are experienced in the field obviously see that. But it's really important for our listeners that there is no magic bullet. There's no one thing fits all. It's how do you make this unique for every individual? And although PVC is how do we help prepare, whether we do it directly with an individual through games that they prepare for and countless types of games, or whether it's nonchalantly through parents setting up the world or, the silent goals as we call them versus the active goals. How do we utilize the PVC in many of the strategies? And I think it's important to talk about, the different aspects of preparing. And it's exactly what you said, those whys, whatever they may be. And of course, there's many different whys. The anxiety is created from the whys. And most individuals with selective mutism have multiple whys. It's not just one why typically. And so it's understanding what those whys are and how to support that individual. And of course, that's a big part of what we do through the selective mutism evaluation or interview is determine what those whys may be, whether we need to dive deeper, and then begin to understand their stages of communication to set up their treatment plan for home, real world, and then school-based accommodations and interventions. And I bring this to our listeners because it's not just do a PVC, it's why are you using this method? How do you use it? When do you use it? And where do you use it? So what happens when we prepare? We create predictability. Talk about the anxiety with that, how that minimizes the need, kind of the anxiety component of that. And how are ways that you prepare your clients? How do you talk to them? about
Yeah.
this?
So I think that what's really interesting, and those that work with us know this, is we talk a lot about our anxiety before we do an exposure and maybe after. And one of the reasons we do that is because there's actually something called anticipation anxiety. And really, what that anticipation anxiety is the anxiety around what is this going to look like? What is the scenario going to appear like? How are we going to navigate it? Who's going to ask me questions? What type of experience is it going to be like? So, there's a lot of things that are going on for an individual even before they step into an exposure or an interaction. So that anticipation anxiety is really, really high. And most of the time, what we do, and for those listeners that have been here for a while, we've talked about feelings charts before and like other podcasts. Feelings charts are used a lot when we're trying to navigate our feelings, right? Our anxiety. So whether it's for an older teen tween, we use like 5 to 0. For a younger child, we might use 3 to 0. But it's the same type of scale where the higher the number, the more anxiety we have, and the lower the number, the more comfortable. So, what's interesting is most of the time when I prepare with my clients, most people will say to me that thinking about going into an exposure, let's say they're going into a birthday party for their friend, it might feel like a 5 or a 3 if it's for a younger child. It might feel really, really hard or scary to do. And then as they're doing that, what's interesting is after they process it, then later on they're like, oh, wait, it actually felt like a 3 when I got home. But the anticipation of it felt really scary. So that's one reason why the P out of the PVC is probably one of the most important components is that preparation is key. Because if we're already going into these scenarios, already feeling like a 3 out of 3 for a younger child or a 5 out of 5, think about how unlikely it is that we're going to go in feeling ready to have some of these social interactions when that's the whole point of us setting the world up, is to kind of have some of these exposures. So the preparing part could look like many different things. Let's say a child's preparing for a birthday party, right? Maybe it's looking online to see what does this birthday party look like, asking the parent of the child whose birthday party it is, like, who's attending, so they can kind of start to visualize what peers are going to be at the birthday party. Maybe they start to think about what questions might people ask. So it's winter time, right? I mean, almost spring, but as Dr. E said, it's been snowing, at least in Philadelphia, for a while. So people might ask, like, have you enjoyed your snow days, or what type of things are you looking forward to for this spring? Are you going away for spring break, right? There's so many questions that you can prepare for. And so as you're hearing, a lot of this isn't just even having the interaction, but rather just preparing for the scenario. So that way we can go in with maybe our anxiety being more like a 1 or 2 out of 3, or maybe like a 3 or 4 even out of 5. So that way it's not totally our most anxiety provoking, but we're going in a little bit more prepared. So that's just an example of a birthday party, but we can totally talk about so many other scenarios as well.
I mean, we could
Just
look
one.
do like hours of different scenarios. And I think what's really, really important for families and for individuals going through this is that that's the whole point of therapy, is to what's gone well this week, what are you working on, or this month, and what, walking through these scenarios. So to play devil's advocate, you have this family that comes to us, and the question is, my child's been in therapy. She's very resistant. She doesn't want to do these games. She doesn't want to do these goals. She shuts down. I'm at a loss. And this is where silent goals come into play. This is where parents set up the world. And an example is you're going to the birthday party that you're talking about, or a party in general, or a gathering. And rather than the child being actively involved in the preparation, the parent will subtly say things like, hey, we're going to, so and so's party. It's at this particular roller rink. Let's go check it out. Like this weekend, let's go check it out. This happened recently with a pottery party for a 13-year-old. They were doing color me mine type stuff where they're coloring the pottery and painting it. And the party was for one of their friends, like in 2 weeks. But the couple weeks before, the parents said, hey, let's go check out the place. Let's go. It's Saturday afternoon. We don't have a lot of plans. They went themselves. The child got very familiar with the location, picked out some of the things that she wanted to paint now and maybe at her friend's birthday party, and it got used to that. And so by the time the party comes along, she's already been there. Maybe they pick up a friend and they go in with a friend. So it's all of this preparing in the background that can occur without the child being, oh my gosh, I need to do this. Also, there's different strategies for a more active approach to help with preparing. I call it like SM roadmaps. What is that roadmap of that social communication opportunity? The first thing that's going to happen, the second thing, the third thing. Of course, you can't always predict, but you know this is where you're going to go. These are the things that would happen. I need to pick out my pottery. Maybe I get there early, bring a friend, I sit with a friend. What are some common questions that somebody could ask me? What are questions that I could ask? Sandwich questions, action plans. The point I'm making is this preparing isn't just where are we going, it's the roadmap of what occurs in that scenario. So the child or the teen is really prepared for that. And often with my older kids that I work with, teens, and even the adults we work with, they write it out step by step. And the reason I call it a roadmap is it's similar to a roadmap. It's like step 1, step 2, step 3, step 4, like stop 1, stop 2, stop 3, almost like a GPS. And so they create these roadmaps, they have the worksheets they work on, and that helps with preparing. There's a nonchalant way to prepare as well, and that's when you're driving to Aunt Sally's house. You may have a resistant child, but in the car, you talk about, all right, we're going to Aunt Sally's. And you talk in general to all the kids in the car, or just even your spouse or partner. What do you think Aunt Sally's going to ask us? And so nonchalantly, silently, I call it silent goals, that we talk about the questions that could be asked. We talk about, what could we ask? And so it's done in a subtle manner. Behind the scenes, we may tell Aunt Sally and Uncle Bill, hey, give so-and-so time to warm up. Don't ask questions right away. But if you're going to ask questions, here's 3 types of questions to ask. And what you're doing is you're creating these opportunities behind the scenes as a way to help your child prepare, because maybe you are doing a common question goal or a common question game, or you're creating those action plans. Who's going to be there? What can they ask? What's your answer? What could you ask? And based on the stage of social communication is how that is implemented. All the different stages. Any thoughts on that? Any comments on that?
No, I just think that many times when we work with people, we go into scenarios and families feel that, okay, the most that the more exposure that we have, the better. And that's true, but it's actually the preparation that happens before the exposures that are probably the most effective part is us, as parents, listening and learning about our experiences and maybe going into these future experiences that much more prepared. And so I think, as you're saying, like, it might not be that the child is super prepared in terms of having this in an, back and forth conversation, unless they're ready for that and they're motivated and they want to talk through it. Because I have many teens and tweens that I work with, and actually young adults, that are very much on that front seat, and they're going through these things, and we're role playing in sessions so that they're prepared. And actually even younger children too, if they're really so I'm not saying that we're not fully in that driver's seat with them, but like you mentioned, for those kids that maybe experience more of those higher expectations, it's really the what's happening behind the scene. And sometimes, in addition to, like, let's say driving to Aunt Sally's, I might actually say another level of preparing might be calling Aunt Sally ahead of time and saying, hey, by the way, we're going to, like, nonchalantly just say, what could some questions be that maybe Aunt Sally and Uncle Bill might ask us? And that way, when we go, maybe Aunt Sally and Uncle Bill know that. And so they're actually asking purposely, but the child just thinks it's, just by chance because they kind of prepared that in the car. So sometimes I might even do even more preparing by having, whether it's extended family, teachers, birthday party, peers, all these things, kind of having them behind the scenes as well.
Yeah, no, I think that when we talk about, setting the world up for the child, the silent goals, it's a combination often of silent goals, more or less based on that child's expectation and readiness. But there's so many kids, young children, where we're setting up worlds. We're playing the common question game. We're playing different interviews and question answer games or board games, or we're doing the guess who and the guess characters for younger kids, or the older kids are doing their assignments of interview questions, or they're doing the big 5 words, or has head up, eye contact, smile, say hi, whatever the big 5 word is. There's countless goals. There's countless games. It's how do we put that together for that individual based on their whys, because certain kids based on their whys will do better with certain strategies and interventions and how parents question and when. And that leads us to the V part, the visuals, whether it's a restaurant, creating the menu, having the menu on your phone, knowing in advance, again, preparing. But by having a visual, you're minimizing the need to think and process, visual processing. It's very interesting. Some of the research we did showed that visual processing was affected in kids with SM from even like a sensory standpoint and an anxiety standpoint. By having that script, by having that visual, it really does lower their anxiety because it allows for the predictability.
Mm-hmm.
Talk to us about some of the ways you use them in your practice and set them kids up with that.
Yeah.
And parents.
Yeah, well, I think before we talk about how we utilize it, I want everyone to kind of visualize, many times when I talk about visual processing, there's so many times where parents will say, we did this, this, and this, and this didn't go as well, but this other thing went well. And I'll say, okay, well, let's take a pause, for the thing that didn't go as well. Walk me through what you did. Did you prepare ahead of time? Yeah, we did. Of course, we talked about it. And I'll say, okay, well, we talked about it, but did we write down the questions? And then I would say like 8 out of 10 times, most of the time, parents are like, no, I guess we didn't write it down, but we did talk about it. And I'll always emphasize the importance of seeing that visual. Seeing it means so much because, like you're saying, the visual processing piece is a huge component. And many times I'll kind of describe it's almost like when you're going to a restaurant and you're looking over the menu, and let's say you want a chicken Caesar salad, and you look at the menu, you're constantly like, okay, I'm gonna get a chicken Caesar salad, and then the waiter comes up and you're having a conversation, let's say with your friend, and the waiter looks at you and goes like, what do you want? And then you're like, oh wait, 1 minute, and then you like look back at the menu and you're like, oh, chicken Caesar salad, right? That happens all the time. So many people, that happens to me all the time. And it's not even because my anxiety is so high, it's just my processing is so low because I'm having a conversation, I got distracted. And so that visual piece really squashes all of that time to think and process. So the visual is really important. But I think one example or some examples that I do in session, for a younger child, like you're mentioning, it could be if we're thinking of a restaurant, maybe making fun visuals, of all the different items that they might want at a restaurant. So whether it's a child who goes to the same restaurant over and over and they laminate, a piece of paper that has their chicken fingers or their French fries and their chocolate milk, or whether it's a teen that maybe prepares by putting it on their phone in their notepad or their notes app, or maybe it's going into a store and writing down a few items that you're looking for. And for a younger child, maybe that's finding a fun scavenger hunt and they're looking for, different items. And so, or for an older child, again, maybe they put it in their phone. So we're really seeing these visuals as we're experiencing these exposures. And of course, we'll talk about that in session. Like sometimes, especially for my teens who maybe experience more of that heightened self-consciousness, or it's starting to impact their self-esteem, they might not want more attention on them. And they might feel like, oh, if I'm holding up, a list here, that might draw more attention. So I might say, okay, well, let's talk about this. Could we make a visual? I mean, even if we're looking at it in the car or we're looking at it right before the exposure, can we at least see something so that way we're going in even more prepared? So there's obviously ways that we can tweak it. I'm not saying we're going to be carrying around a script with us for the rest of our life, but there is a component of seeing a visual that's really helpful. And other components too could be maybe going to a get together, right? So it's March now, maybe there's a spring break going on and maybe there's family that we're visiting in Florida and we don't know what people might ask. And so maybe we make a visual, fun questions people might ask us and we write down our answers, of course, so that way we're even more prepared. So there's so many ways that we can make visuals in some of the exposures that we do, but those are some examples that I could think of. We'll get back to the episode in a second. You're exhausted from advocating, explaining, and hoping someone finally understands. Well, we do. This summer, consider Communicamp for you and your family. Communicamp is the Smart Center's intensive all-day treatment program designed to help children and teens ages 3 and up build social communication confidence. Over the course of one full weekend, your child or teen receives 15 plus hours of expert-led skill building, while parents receive 15 plus hours of training and support. Our clinicians use Dr. E's evidence-based treatment, SCAT, that's helped thousands of individuals find their voice. Here's what matters. Unlike other programs, your child or teen doesn't need to talk to come to camp. We meet them exactly where they are. We have 3 Communicamp weekends happening this summer: June 26th to 29th, July 16th to 19th, and August 7th to 10th. Visit the link in this episode's show notes to learn more. Stop waiting for your child or teen to grow out of it. Make it happen this summer. All right, let's get back to this episode.
And a couple things that's kind of came to mind as you were talking is the repetitiveness. I often say to families, pick 3 restaurants, 3 stores in an ideal world. Your favorite 3 restaurants, your favorite 3 stores. And you know why I do that, because repetitive lends itself to minimizing the need to think and process. If you know you go to Cheesecake Factory, even though we may suggest go during off hours, don't go right at 12 o'clock, maybe go at 11, maybe go at 2. Whatever it is, go early for dinner, go later for dinner. Try to avoid loud, large, lots of people environments if you have a sensory sensitive child. Although the more predictable that location is, the more that child regulates themselves. But let's say Cheesecake's your favorite restaurant, and you know when you go to Cheesecake, you get chicken enchiladas. You just love it, and you get that like chocolate chip cheesecake. You do it so many times that you don't even need your visual anymore.
Right.
Because you know what it is. It's like backwards and forwards. I get my chicken enchilada and my chocolate chip cheesecake. It's like right there. That's the value of repetitive tasks. And we do that with a lot of the games we do, a lot of the interviews we do, back and forth, repetitive, because it lends itself for inner control, predictability. And that sense of control, the predictability, what does it do? Woo! Lowers the anxiety.
Yeah.
Also, involving these kids in creating their visuals. I'm amazed how many times when I'm training different professionals and they'll observe me in session. And I remember this specifically with a very seasoned PhD, PsyD. It was a very seasoned psychologist. And she watched me and she said, why did you, I saw a few sessions, in the clips that you sent, why each time did you have the child recreate their feelings chart? Like, why not just use the same feelings chart over and over? And I said, well, that's a great question, but here's why I do it. And at this point, it's pretty kind of part of me, and I don't always think about it because it's so innate for me. It gives them a sense of control. When they're creating it, they own it. They get it. It's theirs. And so it's the same thing with creating their bridges and knowing where they're on the bridge, or creating their menu, or creating their list of things they want in a store of high interest, let's say, or the common question chart, or the I Spy games, or whatever it is you're doing. The more they're involved in creating these visuals, not just mom doing it or dad doing it or the teacher doing it, because they don't own that. They're disconnected more. So that's why when we're at Communicamp or we're in individual care, they're creating this and they own it. It's theirs. They pick the colors. They pick the things they want to use to draw it or make it. So those things kind of came to my mind as we were kind of discussing this, and you were talking about the visuals. And there are, like you said, subtle ways. Most of the individuals that we work with eventually have these devices. I mean, hopefully they're time limited, but they bring their device to, Cheesecake Factory, and that's an approved place to use it. It's so normal to have your phone or your device with you. Even when you're going to a store and you have your shopping list, it's a great way to use your device in a way that doesn't bring attention to you. I mean, when I go to the grocery store, I have a list on my phone. I'm always looking at it.
Yeah.
Of course, I always get like 20 things extra, but you know what it's like, right?
Yeah, no, and I also think that one of the other reasons why I love visuals so much is I think about our Communicamps and how we use visuals in so many different activities. And one of the activities that I think of is we do a poll activity where we have these polls that are visuals, and they're questions like, what's your favorite animal, or what's your favorite color, or what's your favorite TV show, what's your favorite season, right? There's so many different ones. And then there's different options, and we see the visual of it. And what I love about it is it allows all individuals on all stages of communication to engage, right? Because sometimes if we don't have that visual, it kind of creates those individuals that are maybe just stepping on the bridge, who are ready to do a little bit more of that nonverbal engagement. It allows them to have more of that engagement by showing their pull or by pointing, rather than if you don't have that visual, it kind of keeps them off the bridge. They're kind of more in that stage 0. So I love it because obviously we always encourage, we start with stage 3 of asking them, and we're about to go into choices. We'll ask them a choice usually with the visual of, oh, what's your favorite season? Do you like fall, winter, spring, or summer? Right? And so if they're verbal, great, they have their visual and they can read it, winter. If they're using maybe a transitional strategy, let's say they have a peer that they're using as a verbal intermediary, they can share with their peer, winter, and their friend can tell us. Or if they're nonverbal, again, they can point to winter or show you. And again, that's so much more effective because if we didn't have the visual, it could create so much more difficulty with them reaching and kind of showing you what they're trying to get to. So that's one thing that I love. I also love having individuals have the opportunity to create visuals on the spot. So if you're having an interaction and let's say the child is freezing, giving them opportunities to have either like a whiteboard or a piece of paper or even like their phone or tablet. So that way, if you're asking them a question, I might pause and instead of saying, oh, they're not going to answer me, I might say, wait a minute, write down your answer. And let's say they write down, like for the question, what's your favorite color? Let's say they write down pink. And then once their visual's there, that's when I question them and I say, and what's your favorite color? And again, depending on what stage on the bridge they are, they might, if they're verbal, they might say pink, or they might, if they're making sounds, go p, or maybe use a friend as a verbal intermediary, or they could point to pink as well. So sometimes it's also on the spot we make visuals, and we want to encourage either our teachers or other relatives to do these type of experiences as well, because it might be that our child, especially for those kids with the underlying whys of those learning and processing challenges, they might just need more time to think and process, right? I have many clients that they just need 60 seconds or 90 seconds to really form their thoughts. And so the visual piece is so key. I think that's something that we should definitely encourage for all people to be working on, is not just creating it ahead of time, but even in the moment, having visuals as well.
Wow, there's so many things like you talked about that I could kind of go off on all these tangents. You talked a lot about stages, and I want our listeners to understand, and some may have just grabbed this as a first episode they've ever heard of Unspoken Words. Maybe they don't know much about our work. But for those that are seasoned, I hope what they picked up from that is that we are not encouraging a lower stage on the bridge. If anything, we encourage a higher stage so that when we greet somebody, we may say, ask a question that would elicit verbal. But when they're not answering, we can't drill it. We can't force it. We have to meet them where they're at. So very often when we have nonverbal individuals, and as you know, Dr. Jenna, like for us at Communicamp, you don't have to talk to a counselor to get into this program. That, we don't have lead-in sessions. We have the selective mutism evaluation to meet them where they're at. So if they're nonverbal, they can still attend because the goal is to meet them where they're at and use transitional strategies to progress them into verbal. And as we know, the majority, almost 100% of them, progress into speech at camp with the strategies we use. So I think it's very important for our listeners to understand that we are meeting them where they're at as a first step. We bridge down to meet them where they're at and we move them up. We don't stay there. And even with the use of the verbal intermediary, when it's, do you want red or blue? No answer, red or blue, tell Rebecca. That's a really easy way to use an intermediary and facilitate it. But there's many times we have to tweak the intermediary and increase the distance and play a game that way. Or the older individual needs to fist length, half an arm, full arm. We set up these charts. So I'm only saying this because I want our listeners to understand it's not as simple as just a choice question. It's not as simple as just a visual. It's how do we put it together for that particular individual, meeting them where they're at for their whys, but also for their stages of social communication. Also, when you said, which I really liked about, in the moment, I'm picturing a small group, we're big with progress doesn't occur in a group, so it's away from the group. And how do we do it? Through small groups, through buddies, blah, 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 blah. And so we know that. So I'm picturing a small group where the teacher's asking a question, what their favorite season is, because it's ending winter, coming into spring. Hey, what's your favorite season? Focusing on other kids first is a way to prepare subtly because the child has a chance to think about their answer instead of them being the first one in line to answer. So that gives them a chance. The teacher knowing that child will do best with write it down. So the teacher may, again, say, hey guys, why don't you write down your favorite season, everyone? And then that gives that child the opportunity to read their favorite season. So we integrate these strategies, these interventions specific to these kids that would help them without bringing a lot of attention to it.
Mm-hmm.
And by focusing on another child first, focusing on a sibling first to give your order, I give my order first, dad gives his order second, it gives that child a chance to advocate when they're ready, but also know that sometimes they get a little nervous. Some kids will jump right in eventually.
Mm-hmm.
I'll have my chicken Caesar, and that's great. But if they don't, it's okay. We want to involve everyone in the process, not just isolate that child out.
Mm-hmm.
So we talked about visuals. The more, seeing it minimizes the need to think and process, lowers their cognitive load. It's right there. It's repetitive, the same things over and over. And the reason we talk about choices, and we're not doing choices for long, if anything, we pull them away sooner. We go to more direct questions and eventually open-ended questions. In fact, we often say choices with visuals, direct questions with visuals, pull away the choices, just say direct questions with visuals, maybe open-ended with visuals, maybe eventually open-ended thought-provoking questions. So we will, kind of move along that continuum based on that child's setting, who they're with, and their readiness. And so I think it's important for our listeners to understand that choices is a really easy thing with the right answer second.
Yeah.
So, Dr. Jenna, give us some examples of ways that you use choices with your clients in session.
Yeah, well, I mean, I think going back to even the example that I just gave with the polls, many times, even though they see the visual of what's your favorite season, and then there's all these different options, I still many times will give a choice. So let's say I say to a child, okay, we're going to go over what's your favorite season. I want you to write down your favorite. So let's say they write it down, and I see that they wrote down winter, right? Or they circled winter. I might say to them at first, like you're saying, I might test it out a little, and I might say, what's your favorite season? And if I wait a few seconds, I might then look at them and I say, is your favorite season fall or winter? Right? And just having the subtlety of having that last answer being the right answer, it's the last thing they heard. So they're more likely to just kind of repeat exactly what you said. So it helps them with their processing. So that's an example of how we do that. Or many times, I actually might start to use choices as a starting point for initiation. So when we think about the social communication bridge, and I know we started talking about it a little bit today, there's two components of the bridge, right? There's kind of a back and forth of communication. So there's a responding piece and an initiating piece. And what's interesting is most of the time, kids and teens and young adults and adults, individuals have a harder time with initiating than they do with responding. So choices is actually a really great way to start the initiation process. So if let's say we're going back to the what's your favorite season, I might say, all right, and I'm going to now have you ask me a question, okay? I'm going to write down some questions here. All right. Do you want to ask me what's your favorite sport or what's your favorite season? So again, we want the visual. So I might have a child. I might pause and say, I want you to circle which one you want to ask me, right? And maybe they circle season. And then I might re-ask them and I might say, what do you want to ask me? Do you want to ask me my favorite sport or season? And then they repeat season. Or again, depending on where they are in the bridge, right? We want to respect that. So that's another way to start that process, because many times families will say, all right, my child is responding when needed. Obviously it's maybe more shorter responses and I want them to expand a little bit, but it's really the initiation part. They're not comfortable initiating. So choices is a great way to start that process, because again, the more open-ended and the more expansion, especially for kids who have underlying speech and language challenges, we have found that most of our kids have expressive language when it comes to the speech and language. So expressing themselves with a longer sentence could be harder. So the choices also just help by being very simple and being direct.
No, really, really great points. And I want to ask our listeners a question. If your child is verbally responsive, one of the number one questions we get is, how do I get him to be initiative? And I'll say, and I say this all the time at Communicamp, I'll say, what do you think the chances are if your child is verbally responsive? And you know the answer to this, that's why you're smiling. What are the chances that if your child is verbally responsive, that they will become verbally initiative very quickly, almost like within a minute. And they'll look at me and go, but he's not initiative. I go, but he's responsive. And they're like, yeah, he responds, but he doesn't initiate. I go, okay, I can guarantee you 100%. This isn't like a magic trick. Feeling I'm creating a magic trick, that he will become verbally initiative within 3 seconds. And they're like, that's not true. There's no way you can do that. And I'll say, okay, well, he reads, he writes, and he verbally responds. So going back to what's your favorite season, it could be anything. It could be like, when's your birthday, or what's your favorite sport, or where are you going for spring break? I mean, it doesn't matter. One of the common questions, it's any question. I'm just going back to what's your favorite season. And I say to that individual, let's write this down. I'm going to write this down. You write it down. What is your favorite season? And they write down what is your favorite season. And I say, okay, great. Now, why don't you just read that to me? And they go, what is your favorite season? Boom, verbally initiative. So that script approach for a verbally responsive individual to write and read is a very powerful strategy that teachers can use in class. Parents can use for interview questions for aunts and uncles. They can use during board games where they write out their question and they read it. Yes, it's not spontaneous, ready to go conversation yet, but it's a step in the process. And what I want our listeners to understand, you don't go from 0 to 100 with one snap of a finger to be the most confident, comfortable, connected, verbally responsive, initiative, elaborative individual by offering them prizes and rewards. For most or not, individuals that struggle with social communication and selective mutism, it's the many steps in between that lead them to a more confident social communication opportunity and encounter. And so these different exercises, these different strategies, setting up the world for the child, the games, the goals, the creating the rewards, whatever it may be, is a step in the process to becoming a confident social verbal communicator. It's not just do it, not just go up to the store clerk and ask a question. In fact, so many of the clients, the patients we see at our center who have been in past treatments that didn't make progress, the pressure was so great to verbalize when they weren't there yet. And I need to preface, they weren't there yet. So it's respecting them where they're at, meeting them where they're at, respecting their stages, understanding their whys and how they play into that individual's presentation. And then training the parents, training the teachers, and getting that child actively involved. I call it acknowledgement and assessment. There are many we see that aren't there yet. They're not acknowledging it. They're not able to assess their feelings 0 to 5, 0 to 3. That's a part of the treatment to gain the sense of control and to build the long-standing coping skills. Mm-hmm. And so it's very, very important that all of this works together. It's not just one piece. It's all of it working together like a fine oiled machine. I just gave a whole dissertation, Dr. Jenna.
No, I think that's great. And I also think, again, like everyone is very different. So the way that you kind of scripted out, like, what's your favorite season, and they followed you, there's many kids that might need one word at a time. Like what is
your, right.
And you're kind of going through it. Or there's some kids that even saying the full sentence might be harder. And that's why I was saying, starting with the finish the sentence, where I'm saying, what's your favorite? And do you want to ask me animal or season? And they're repeating season. So there's so many different ways. And that's where choices, kind of going back to that last part, because I know we kind of took a little detour, but the choices piece is
we always take detours when I'm doing this.
I know. But going back to the choices, I think choices are really, really powerful. And especially for those kids that have underlying learning and processing challenges, have some underlying speech and language challenge, might experience
autism spectrum.
Yeah, exactly. So there's so many different aspects to why it might be harder for an individual to answer open-endedly, especially when, maybe our anxiety is starting to decrease and we're still experiencing some of those challenges. So I think that the choices is a really, really powerful key. And I think that's sometimes where, unfortunately, sometimes teachers, I find, don't always ask those choices. So they're asking questions and they're doing these things, but maybe they're not providing some of those opportunities to say, wait a minute, write it down. Oh, did you write this or that? And kind of giving that visual and the choice all ahead of time.
This has been great. PVC is a way we teach parents. And when you said you come back and let's say we review how things were going and something didn't go as well, we will back up into these checkoffs. Did you prepare? Did you have visuals? Did you have choices? Or was it a loud, large, lots of people environment? Was the child hungry, overwhelmed, underwhelmed? And we start to figure out the look, listen, and learn about this individual. You know, you don't like, you have to you have to look and see why something worked well and why something didn't work well. And that's how you really get more continuity in progress, because you start to realize, you know what, my child comes home after school and that's some time for me to take them out and do exposures, but my child's exhausted. She just wants to vegetate. Well,
Right.
guess what? That's not the time to take her out. You know, we often think about that. Like, you know, as an adult, you can make a choice of when you're going, where you're going, and making changes to your plans. Wow, I was supposed to go shopping today. I'm exhausted. I'm just going to order Instacart. You know what I mean? But children tend to be dragged along because it's better for our schedule.
Right.
And so it's very important that parents really do look, listen, and learn and see what works for their child and understand that as these exposures are put into place.
Yeah.
So this has been a very powerful podcast, and I think our listeners are going to get a lot of value to this. And any last minute words, Dr. Jenna?
I feel like we went over a lot today, and I think that, again, there's so much power behind PVC and so much of, you know, how it intertwines. I think as we're talking about visuals and choices, that in itself can help with the preparation piece, right? Of kind of creating choices, creating visuals. So I think that I encourage those listeners that maybe whether this is your first podcast that you're listening to or you've been in treatment with us, I do encourage you to start to implement some of the PVC and start to see if you start to look, listen, and learn about your child. Do you notice any changes in their behavior? Do you notice more readiness and more encouragement, right? Because I think that there's a lot of strong aspects to this intervention. And I think that it goes really, really far. So we're happy that we got to talk about this today. And I'm looking forward to, you know, seeing so many more families utilize PVC.
Thank you, listeners. Please check out the show notes for some additional supportive material on the topic of PVC today.
Thank you.
Thank you. Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.